last month, a very large study, in fact, the largest study on patients with heart failure with preserved ejection fraction was presented in the European Society of Cardiology. And this was simultaneously published in the New England Journal of Medicine. This included more than 6,200 patients of heart failure with either preserved ejection fraction or mildly reduced ejection fraction, that is, an ejection fraction ranging from 41% to more than 60%. Now, these patients were followed up for almost 2.3 years, and what was found was that dapagliflozin, an SGLT2 inhibitor, at a dose of 10 milligrams per day, reduced the composite endpoint of cardiovascular mortality or an heart failure emergency, which was defined as either an admission for heart failure into a hospital or an emergency visit to a hospital for heart failure. This was reduced by 18%, which was significant. Apart from this, heart failure emergencies were reduced by 21% and mortality by 12%. The added advantage here was that the adverse effects were the same in the treated group versus the placebo group. Now, dapagliflozin is an SGLT2 inhibitor, that is a sodium glucose cotransporter 2 inhibitor. Earlier, the same drug in the DAPA heart failure trial had shown a 20% reduction in cardiovascular mortality or hospital admissions when used in patients with heart failure with reduced ejection fraction, that is an ejection fraction less than 40%. This time around, this study, that is the DELIVER trial, showed that the efficacy of this drug was seen across all ejection fractions. It was also seen in patients who had an improvement in their ejection fraction from less than 40% to more than 40%. There was also improvement in patients who were obese, as also in patients with very severe heart failure. That is an NYHA classification of 3 or 4. The other good news is that this drug is freely available in India, and the cost is around 18 to 20 rupees per tablet. Only one tablet is to be used in a day. So the take-home message is that the bedrock of patients with heart failure, regardless of whether they are having a reduced ejection fraction or a preserved ejection fraction, is that we introduce an SGLT2 inhibitor, which could be either dapagliflozin or empagliflozin. The dose, remember, is 10 milligrams per day. Thank you very much.